Hello and welcome to the Housing and Services Resource Center's webinar, Ending Homelessness, Developing Partnerships Between HUD, or Housing and Urban Development, Continuums of Care, or CoC, and the Disability, Aging, and Health Services providers. Today we'll learn about the HUD Continuums of Care, or CoC, and Coordinated Entry Systems, and how colleagues in disability, aging, and health sectors are part of continuums of care and the benefits of these partnerships. Thank you so much for joining us. Next slide. My name is Lori Gerhardt. I'm the Director of the Office of Interagency Innovation at the U.S. Administration for Community Living, an agency within the U.S. Department of Health and Human Services. I will be serving as the facilitator for today's webinar. It's a privilege to have so many of you here with us. Your active involvement in this webinar is essential for us to have an engaging discussion, and I want to thank everyone for introducing themselves using the chat. We continue to learn from our presenters and all of you that participate in these webinars. It will take all of us working together to achieve our collective goal to increase housing stability and to help those who are experiencing or at risk of homelessness to be able to, or those who may be living in an institution, to obtain and maintain stable housing and the services they seek to fully participate in the community. Next slide. Before we start, we'd like to address a few housekeeping items. This meeting is being recorded. By staying to participate, you are consenting to the recording. Also, all attendees' microphones have been muted for audio quality. One hallmark of our webinars is active participation from attendees. Please frequently use the chat to make comments and submit your questions anytime in the Q&A feature in the Zoom dashboard. Or you may email a question or comment to hsrc@acl.hhs.gov. We have reserved time to address your questions during the session. And if you're participating via the YouTube live stream, please submit your questions by emailing us at hsrc@acl.hhs.gov. You can also use the chat or email if you have a technical issue or comment for other attendees. Next slide. Before we start with the presentations, I'd like to tell you about the Housing and Services Resource Center, or HSRC, which is a partnership between the U.S. Department of Health and Human Services, or HHS, and the U.S. Department of Housing and Urban Development, also referred to HUD as HUD, HUD. Every state and community has a number of agencies, organizations, and programs helping people access housing and supportive services, but the housing and service systems often are siloed. Stronger collaborations between these systems would enable more people with disabilities, older adults, and people experiencing homelessness to achieve housing stability, live with dignity and independence in the community, and avoid homelessness and costly institutional care. The Housing and Services Resource Center, HSRC, brings together federal agencies and our technical assistance providers to cultivate, strengthen, and support cross-sector partnerships in communities, states, and across the federal government that bring together housing, homelessness services, aging and disability services, health, including physical health, behavioral and mental health, and public health services. After the webinar, we hope you will look at the HSRC website at acl.gov/housing and services. At the end of the webinar, we'll share an email address so you can be in touch with us and get periodic updates. Next slide. The HSRC serves many sectors, each with its own unique terms, policies, and practices. Today's webinar brings together the homelessness, continuums of care, and coordinated entry systems and the disability, aging, and health sectors to share the approaches they have used to work together, and they'll talk about how these partnerships benefit the people we serve and our organizations. It's been interesting developing this webinar as we're discovering that the homelessness continuums of care and coordinated entry systems and the Aging and Disability Resource Center, No Wrong Door Systems, Centers for Independent Living, area agencies on aging, and community hubs are developing very similar systems, working to braid together the array of housing options, programs, funding streams, and services to help those we serve obtain or maintain stable housing services and live full lives in the community. Today, we'll focus on becoming familiar with homelessness, continuums of care structures, and coordinated entry systems, and identifying opportunities for organizations in disability, aging, health, and other service networks to build and/or strengthen collaborations to reduce homelessness and increase housing stability among those we serve. We're in for a real treat today as we hear from national experts and colleagues in Florida and Virginia who will share their experiences and strategies about how they're working together to serve people who are experiencing homelessness or at risk of homelessness. First, we'll learn about the homelessness continuums of care and coordinated entry systems from our colleagues at the U.S. Department of Housing and Urban Development, or HUD, and the Corporation for Supportive Housing, or CSH. Next slide. It is now my distinct pleasure to introduce our national expert presenters. With us today is Sharon Springer, who is a senior program specialist in the Office of Special Needs Assistance Programs, also known as SNAPS, SNAPS, at the U.S. Department of Housing and Urban Development, and Marcella McGuire, who is the Director of Health Systems Integration at the Corporation for Supportive Housing, or CSH. Sharon and Marcella, the floor is yours. Next slide.
All right, thank you, Lori, and thank you to the folks at ACL, the folks at US Aging, and particularly all of our partners here. We are so excited to have this conversation today, and we are excited to really set the ground here for what actually is a continuum of care program, what are the homeless systems for the aging world that you could be partnering with in your community, and give you some key and basic information. They're your partners, particularly on the housing side, if you're looking for local partners who address homelessness, older adults, and people with disabilities. These partnerships are really, really important. We highlight the partnerships that overlap geographically. Some of them are, working in the SIL is working in Tallahassee and the COC is working in Tallahassee. We're going to highlight them today, et cetera, but they also have different skill sets. They have different funding streams they manage. And so it's really important to understand the complementarity of these partnerships here. Our goal here is to end homelessness for older adults and people with disabilities. Next slide, please. So we're going to talk about why people experiencing homelessness. We're going to talk about why it's more likely that people who are aging or low income and people with disabilities are experiencing homelessness. We're going to talk about permanent supported housing and evidence-based practice that's addressed to meet their needs. We're going to talk about what roles continuums of care play, particularly in creating permanent supportive housing and bringing together community-wide efforts around ending homelessness. We're going to talk about why partnerships are necessary in order to end homelessness, why none of us can do this alone. We all need our partnerships, and we're going to hear from our some successful partnerships locally about how they came into being. Next slide, please. So homelessness, I've always thought about it. I've been in this field for a long time. It's really a game of musical chairs. I like to say there are 16 people out there and there are 4 chairs. That means only 1 in 4 of the low-income renters or need housing assistance can access that assistance. The cost of housing is going up. We all know that. We see it for ourselves. We see it for our communities. It's far outpacing incomes and income supports. And we just have a very limited number of affordable housing options for people on fixed or low incomes. And that is the case for most people who are aging, many people who are aging or disabled. We have a lack of a social safety net. We see people with domestic violence histories, abuse histories, who've been really challenged by their community and their family members. And we have these very separate systems that grew up in very different, what Laurie said, commonly call silos. We said, oh, homelessness is an issue. Let's build the program. And Sharon can talk more about the program that we built there. All of you out there are the experts on let's have services homelessness. Let's have supports for people who are aging, for people who have disabilities. Let's build a public health sector. But those systems often don't talk to each other. They don't collaborate. We're here to talk to you about why that's so important and why it's important to build these partnerships at the local level. We also want to highlight that who can't access the limited affordable housing there is in our community is not random. It's more likely to be persons of color. It's more likely to be people who are disabled and aging, and they just have a difficult time navigating complicated systems. And even if they can successfully navigate the systems, there's just not the housing out there. Just to remember, for folks who work in entitlement systems, Medicaid is an entitlement system, Medicare is an entitlement system. At least in theory, if you can prove your disability to the state, you are entitled to services. There is no such entitlement on the housing side. When the budget is used up, the budget is used up and there are no more resources. That builds a very different system. So next slide, please. So I do want to center the conversation around equity. I want to talk about how disproportionately impacted communities of color are by homelessness, housing instability, and increasing housing costs in our community. People who identify as Black or African American, they're 39% of all people experiencing homelessness. They're 53% of people experiencing homelessness as members of family with children, while they're only 12% of the total US population. A clear equity issue, and there's been a lot of research work begun, but certainly not ended over the last couple of years. For Native American, Alaska Native, Pacific Islander, and Native Hawaiian populations, each of those groups separately accounts for about 1% of the US population, yet they're about 5% of the homeless population. They're 7% of the unsheltered population. In contrast, 48% of people experiencing homelessness who were white, rather than 74% of the US population. Again, you can see the vast inequities here and the need for strategies that specifically target the unique needs of these communities. Finally, people identifying as Hispanic or Latino, they can be of any race, or about 23% of the homeless population. They're only about 16% of our population overall. So all non-white groups are overrepresented among those experiencing homelessness. People who are white are underrepresented among those experiencing homelessness, and the need for strategies to center equity as we work to end homelessness and end these long-standing disparities. Next slide, please. This is a from Harbor's Joint Center on Housing. It really talks about how homelessness is increasing among those who are aging over the last couple of years. Chronic homelessness, and we'll talk about that a bit about that. It's a late baby boomer phenomena, and we see that boomers are in the 58, 59 and up range, and you see how that's impacting. Sheltered homelessness is increasing. The percentage of people experiencing homelessness who are aging is increasing as well. Lots of challenges. In this population, we see people who've been homeless for a long time. We'll talk about chronic homelessness. And we're also see a lot of people are homeless for the first time. They have been working low-wage jobs, not able to save, not able to meet the rising cost of housing in our communities. I also want to note this increase that we talked about and the increases in housing costs. All of them were documented projections before COVID. We expect that with COVID, the challenges will be even greater. So next slide, please. So for people with disabilities experiencing homelessness, we also know that they are significantly overrepresented among experiencing homelessness and or housing instability. They're more likely to experience it than a person without a disability. HUD requires local systems, continuums of care that Sharon's going to talk about, to do an annual literal point-in-time count, counting how many people in our communities experiencing homelessness on a single night. We find that about a quarter of them experiencing homelessness have a disability. When I say disability, I mean this very broadly. This could be physical, this could be intellectual or developmental disabilities. This could be people with serious mental illness, people with substance use disorders, people with any combination of all of those, but at least one of those above. So we know that people experiencing with disabilities are more likely to be low income, are more likely to be poor, and therefore, especially with the rising housing costs, are more likely to be homeless. Next slide, please. So you heard me mention the term chronic homelessness, and this is a very specific term within HUD. There are many programs within the continuums of care that are only available to people experiencing chronic homelessness. The definition of chronic homelessness includes a disability, again, all of those that we talked about, as well as a long-term homelessness. So this is a year, continuous, or 4 episodes in 3 years. Each of those episodes has to add up to at least a year. Homelessness can be a person who's living in fleeing a domestic violence situation, a person who's living in shelter, a person who's unsheltered, living on a street, cars, parks, other locations not meant for human habitation. I'm proud to say that since 2007, the numbers of individuals with patterns of chronic homelessness had decreased by 8%. That was primarily in the earlier part of that decade between 2019 and 2020. This number increased by 15%. I will say that when we targeted resources, and we'll talk also about veterans, there was a significant decrease in veterans homelessness in the middle of the last decade, and that was because resources were targeted to veterans or the Veterans Administration Supportive Housing Program. So next slide, please. So what is the solution to affordable housing? Well, I'm from the Corporation for Supportive Housing.
Hey,
So
Marcella, I think we're getting a lot of requests to slow down. I know it's a lot to take in, and I know we're being very conscious of only having a few minutes, but I think you're definitely getting a number of asks.
That's fine. I can't see the chat, Sharon, so thanks for jumping in there. I appreciate that. So permanent supportive housing is an intervention that combines affordable housing assistance, what makes the housing affordable to a person with an extremely low income, and voluntary supportive services that helps to address the needs of people with disabilities. The services are housing focused. They're designed to build independent living skills, tenancy skills, helping people budget, helping people deal with landlords, helping people be good neighbors, and also connect people with community-based healthcare, treatment, employment, and other services. Supportive housing services sees them very much as a whole care coordination model. With the investments in permanent supportive housing, we've seen the decreases that we talked about, and there's research, always happy to share that has demonstrated that permanent supportive housing can also increase housing instability and improve health. Remember, we're talking here specifically about people with disabilities, about people that are aging, more the chronic homeless population than other people experiencing homelessness. Many people just need an affordable housing option, but for a lot of folks that are aging or have disabilities, permanent supportive housing is really this cost-effective solution. And it's been shown to lower public costs associated with a variety of acute level services, shelters, hospitals, jails, prisons, nursing homes, and other institutions where people are hoping to return to the community. Next slide. So supportive housing is an evidence-based solution. The housing is affordable, permanent, and independent. We think this aligns well with the Olmstead mandate, both the letter and the spirit of the law. And then the services are flexible, voluntary, they're tenant-centered, they're housing-focused. There may be other additional services, behavioral health services, parenting services. Different programs may target different populations, and you may need other services there, but they're tenant-centered, coordinated services. From a values perspective, they align very well with all of the work that home and community-based services, all of the work that you all are doing out there. I also want to highlight the term case management. Case management is a term that means very different things to different people. Case management in the housing world, similar, and homelessness world means a very low caseload, 1 to 10, 1 to 20, hands-on support, very focused on assisting the individual, very different from what case management means in many of the disability and waiver programs where your caseloads are much higher. So next slide, please. And I believe with this, I pass it over to Sharon from Department of Housing and Urban Development. Thanks, Sharon.
Absolutely. Thank you for setting the stage, looking at some of the data that has been gathered to show kind of where we are at this moment. So I'm from the Special Needs Assistance Programs Office. If you look at the legislation, we're called the Homeless Assistance Grants. And this is just a quick snapshot of our programs. The largest by far is our Continuum of Care program. Right now we have our competition is open, and we have, I assume, some people on this call who are very busily working towards the September 30th deadline. That is $2.8 billion. It's the biggest competition in all of government that I believe. We also have block grant funds that are geared, it used to be called the Emergency Shelter Grant and was changed to the Emergency Solutions Grant in 2009 with the Hearth Act, which also put into place more formally this Continuum of Care structure that I will talk about. Continuum of Care is about funding permanent supportive housing, which Marcella just talked about, rapid rehousing, which is for people who have less of a long-term need for support and who with a few months of support could be stable, and in addition, supportive services. We obviously with COVID, a lot of, I would say there's probably a lot of new examples of collaboration that have happened between the health system and housing and homelessness. So our ESG CV fund was almost $4 billion in the CARES Act that is still being spent. And right now we have a special NOFO, which is for people who are unsheltered or in rural areas. And we also have a youth demonstration project. So there is a lot going on in my office, lots of new acronyms for you to learn. If you can go to the next slide. So you're just taking a quick look at this slide. This talks about some of the priorities of this year's NOFO. And usually it is pretty similar. Last year's was pretty similar. You know, focused on ending homelessness, really using that language. But what I would also, and using a housing first approach, making sure that people don't have to jump through hoops to get to housing. That had historically been the way a lot of programs approached getting into shelter, being sober, being compliant with medication, and that shift away from being as low barrier to entry and helping people to get into housing and then address whatever needs are there. I would also point out priority 5 as partnering with housing, health, and service agencies, which is many of the groups that are on the call today. And you know, there's 9 priorities on there that you can see. And these will be shared with you afterwards. You can go to the next slide. So it's a little confusing, but a continuum of care is the body that helps to apply for those funds that are also called continuum of care. So it is a little confusing, but this body is a group of local government, nonprofit, and other entities who work on a range of housing and services, and as well as, and it's really required to bring community partners together. So that is written into the rule, the Continuum of Care rule from 2012, which is requiring that they bring together the hospitals, the health providers, the veterans groups, people who with lived experience being a part of these conversations. So it is really meant to bring people together. Thank you for spelling out NOFO. I know, like I said, there's a lot of new acronyms on both sides. So I think, as Marcella mentioned, there are a lot of parallels to how this work is being done in a community setting. It's meant to be collaborative. It does not have to be a local government body. It could be a nonprofit that is the collaborative applicant and pulls people together, both about the COC funding, but about addressing homelessness as a community. So looking at what are your unsheltered numbers? What are your numbers of people with disabilities? Where are the gaps in services and housing, and how can you work with these local partners to address them? We can go on to the next slide. I'm going to skip this one just in terms of time. What I will say is there are different activities. So, for example, unsheltered outreach can be done through different funding sources. There are a range of funding sources. You know, ours, although it's a large amount, there are many local, state, local, and nonprofit partners that also fund these projects and are required to be partners in terms of match and in terms of collaboration. What I would say is annually, HUD does require that communities gather what they call a point-in-time count. And this is something that if you're interested in getting involved at your community, I would say that is a great place to start. It's usually 1 or 2 nights in January where they both look at who's in the shelter that night, but also who is out on the street. to try and engage them for housing and services and to understand those needs. Obviously, January 2021, it was not a requirement to do these outreach unsheltered counts. So our data is a little bit off for last year. So let's go on to the, and just to say, back to the sort of continuum of care and collaboration is, if you are not already a partner with your continuum of care, please reach out. On our website, on the HUD's website, you can easily find who the leader is and to contact them, to be invited to meetings and to find ways to collaborate more fully. If you can go to the next slide. Very quickly, and I know we're running over, there are different categories of homelessness across the federal government that can be challenging to navigate. So to enter permanent supportive housing, for example, or to enter shelter, you would need to be either literally homeless, living on the street, in shelter, someplace not meant for human habitation, like a car, or at imminent risk of homelessness, which is 14 days out. We do talk about other federal statutes, and each community has some flexibility as to whether or not they use those. Again, the CoC should be partnering with the schools, with the hospitals, with the areas on aging to try and find ways to work together. Obviously, people who are attempting to flee domestic violence are automatically pulled into the system, regardless of where they have come from. And we do have a separate definition for at risk of homelessness that is rather lengthy, but I did put a lot of this in the notes, so when you get the slides, you'll be able to see more detail. So, for example, to come into permanent supportive housing, as Marcella said, you would have to have a disability and be prioritized by your community. And that, I think, is going to be my last slide, the next one. So I'm the lead for our office on coordinated entry. This is a policy that was put into place in 2017 and then asked communities by 2018 to have this in the works. So HUD requires communities to have this system of inflow, both to try and prevent people from coming into homelessness and to divert them to stable housing through other resources, often what we call mainstream resources. But when people come through, they inflow through the system, there are different stages. Historically, it had been a very disorganized and random as to who got into housing. And so the goal here is to be more equitable, to be make sure that it is sort of person-centered and that people are getting the services and housing that they need, and that it works within the system, so that try and reduce both the numbers, make sure that the most vulnerable are assisted first, and that people exit to the type of services that match them. So at the bottom of the screen, the outflow might be permanent supportive housing, rapid rehousing. Some very few transitional housing programs are less, but that could be one, or affordable housing, maybe with a Section 8 voucher, maybe some, or a low-income housing tax credit unit, or a senior program for low-income seniors. So there are a range of possible places for people to come out. There are other slides that we've hidden, but that will be available to you to talk more about coordinated entry. Again, this is meant to be not just about housing, but also about services. So if someone is potentially going into permanent supportive housing, they may need assistance from a range of community partners. And so it is to make sure that those partnerships are lined up so that that household is successful in that housing and can remain there for as long as needed. So I know there's a lot more to say, but I will pass it off. And I think we're going to hear from some local communities that can talk more in detail about how to make this work.
Well, thank you, Sharon and Marcella, for that exciting overview of homelessness, continuums of care, or COCs, and coordinated entry systems. Now we'll turn to our expert panelists working in partnership in Florida and Virginia to hear how the COC and Disability and Aging Networks form these partnerships and the benefits of these partnerships. Now it's my privilege to introduce Jackie Fortman, who is the Assistant Director with Ability First in Florida, a Center for Independent Living, and Jonna Coleman, who is the Executive Director at Big Bend Continuum of Care in Florida, and Joshua Jemerick, who is the Senior Vice President Housing at Bay Aging, and Angie Alley, who is the Assistant Director for Housing Services at Bay Aging, an area agency on aging in Virginia. And we'll ask them to provide some background on their agencies and partnership efforts. We'll turn things over to Jackie to get us started. Next slide.
Hi everyone, I am Jackie Fortman. Ability First is the Center for Independent Living of North Florida. We have a bunch of programs, but the one we're focusing on today is our Homeless Services Department. This is a pretty new department for us, and that consists of a director, which is me, I'm over the program, and 2 full-time staff members who are dedicated to street outreach and identifying unsheltered individuals experiencing homelessness. Their mission is to engage and build trust with homeless individuals with the hopes of getting them into housing, and in the meantime, provide them with necessities while they are unsheltered. The 2021 point in time count identified 91 unsheltered individuals, and this 52 is a typo. It's actually 197 chronically homeless individuals in 2021. I did pull the 22 stats for that too. And there was 164 unsheltered individuals, and with 153 of them being chronically homeless for the 2022 point in time count. With the current spike in rental costs and inflations, unfortunately, it's likely that more and more people will become homeless. Go on to the next slide. Our population target are individuals with disabilities who are homeless or unsheltered. We help by providing food such as ready-made meals, snacks, and drinks. Those basic necessities I mentioned, which are clothing, shoes, sleeping bags, portable showers, hygiene items, backpacks, flashlights, and etc. Transportation, bus passes, so they can get to where they need to go and attend the appointments that we all need to go to. Referrals. We refer in-house for assistance with Social Security and other benefits, and then we provide information regarding local shelters, food banks, career source, mental health, substance abuse treatment, and so on. And then we provide case management, assessing their housing needs, and then arranging, coordinating, and monitoring the delivery of individual services to meet the needs of the program participant. We have in-house rapid rehousing funds to assist people with documentation, or to assist individuals to move, whether that's to regular housing or prepare them for permanent supportive housing, which was mentioned before too. Next. Jonna, were you gonna go over this slide?
Sure. As Jackie stated, we actually partner with Ability First on with several programs, but right now we're working with them through our COC. So our COC does have the largest the population is, I'm sorry, not population, the largest area coverage, I'm sorry, for Florida. We do cover 8 counties. However, the majority of individuals who are experiencing homelessness are located within the Leon County, Tallahassee area. I've seen several people talk about the rural areas that they just don't have the resources. And so hopefully we are able to address some of those through our rural NOFO and in partnerships with agencies such as Jackie's program. Being able to reach those people in those rural counties for us is going to be critical. We do partner with other specifically other agencies such as our Capital City Youth Services that service youths, the Carney Center, which is our largest emergency shelter, Hope Community and Big Bend Homeless Coalition they actually service our rapid rehousing and emergency shelter for families, and then Refuge House, which is our domestic violence shelter, and they also offer some transitional housing, and then also some crisis support lines. We have Ability First working with us through our HMIS system. We also work with them through a COC, HUD COC funded project for individuals who have chronic homelessness with the PSH program. And then we also have a PSH program for families through Ability First. So our partnership is unique, and we definitely know that there's a need for us to partner with agencies that specialize in assisting individuals with disabilities. Next slide.
Thank you very much. So I'm Josh Jumerick, Senior Vice President for Housing at Bay Aging. Could you go back to the previous slide, if you don't mind? Thank you, just to give folks the overview. So honored to be here today. Bay Aging is a 501c3 nonprofit corporation. We're headquartered in the town of Urbana, which is in the Northern Neck Middle Peninsula region of Eastern Virginia. So just wanted you all to have a geographical scope there, or idea context. We're formed in 1978. So for 44 years, we've been providing services with the mission of preserving independence for clients that we serve. You can see Bay Health, Bay Housing, and Bay Transit here. We are an area agency on aging, and we are also a community action agency, both certified by the state of Virginia. This puts us in a unique position to provide services to older adults and also alleviate issues of poverty. With the health, the housing, and transportation, and how those interact in preserving this independence, it's very important. Next slide, please. So I'm not going to go through all the services, but I do want you to have just an idea for the scope of the services that we offer, because they really all achieve this theme of independence. In our health services department, we're offering things like Meals on Wheels delivery, home care, adult daycare, active lifestyle centers with congregate dining and nutrition opportunities, and a veterans directed care program that operates in a multiple state area, helping veterans who are nursing home eligible stay independent. We have, in the next slide, please. We also offer, with the transportation and the housing, the transportation is public transportation. And it's important for securing and preserving independence for folks who are experiencing homelessness, folks in our housing, everyone in the community. It's available because it's public transportation. It's available to everyone at a low cost. We also offer, as you can see in the list, MedCarry, which is a transportation that allows people to go to medical appointments. But we're primarily demand response, public transportation. You call, you schedule a ride, they pick you up at your door, and they'll take you to work, maybe shopping, anywhere you'd like in the area. We also have some fixed routes. And in the housing, really is where our homeless programs fall. We have a variety of single-family and multifamily housing programs that really are integrated and work on a variety of levels to prevent homelessness. On the single-family housing side, we are making low-income homeowners' homes more energy efficient through weatherization assistance. We have an emergency home repair program that can cover and make repairs to low-income homeowners' homes, critical repairs. We partner with local governments on community development block grants, fixing up whole neighborhoods and providing new housing to low-income homeowners. We are the Housing Choice Voucher Program, some know as Section 8 administrator for many of the local governments or local areas in our service region. And we've developed and we currently operate numerous communities, rental housing communities that are mostly age restricted, not exclusively, but for the most part, they are age restricted. They're all income restricted. But this supportive housing that we have developed is very important in preventing homelessness. We have close to 400 units under management at 12 distinct properties. And then we have a menu of we call homeless solutions programs, rapid rehousing, homelessness prevention, housing navigation, recruiting landlords and engaging with landlords. We are the coordinated entry point of contact and operate that hotline. That is an important entry point to all of our services. We manage HMIS data. HMIS is Homelessness Management Information Systems. And we act as the lead agency for our, we call it local planning group, but really it operates like a Continuum of Care, a CoC. We just fall underneath the state of Virginia Department of Housing and Community Development's balance of state CoC. We fall under that and operate our local planning group, which really operates the same way as any other CoC. We've quickly, I'll say, we've implemented a number of homelessness prevention, I guess, add-ons possibly, or augmentations to our programs. We have a homeless preference for all of our rental housing, a system that HUD approved formally. We're very proud of that. We offer emergency housing vouchers through our Housing Choice Voucher Program. And we have a team of housing case managers that will really handhold the folks and get them set up in the permanent supportive housing that we're operating. So it really is to give you a flavor for the menu of services we offer. We've really embraced that. I'll let Angie just talk a moment here about a little bit more. Next slide, please.
Good afternoon, I'm Angie Alley, and most everything, in the essence of time, since most everything that I was going to cover has been covered, just want to say that Bay Aging's Homeless Solutions team, we provide coordinated entry. We work with these partners, a list of potential examples of partners that we have in our Continuum of Care on the slide right here. But one thing, Josh mentioned our homeless preference, and that's been really successful for placing our senior folks into permanent supportive housing. But another thing that we found was necessary, we had folks that were having difficulty assimilating once they were actually placed in our apartment communities. And so we formed a transitions team, and that's comprised of our case managers and our resident service coordinators who work on site at our apartment communities. And sometimes folks just need a little extra help. They need a team of folks that can come up with some creative ways to help them out. And that has been a successful program for us. So I just wanted to make sure that we added that to our list. Thank you.
All right. Well, thank you everyone for this. I just want to acknowledge in the chat, there is a lot of discussion and a lot of people who are, both people themselves who are experiencing homelessness and challenged and can't meet their needs, can't find housing, can't find the services. There are lots of people who run programs, who are also trying to assist with far too few resources. We're not going to have the answers to all of those questions here, etc. But please keep putting them in the chat. Please keep making your voices heard. And we will work to questions that we can begin to answer there. But I just wanted to acknowledge that. So our first question for our panelists is a basic of, how did your partnership start? how did you begin to build? I hear Josh, I hear you're a AAA as well as a COC. I hear incredible partnerships happening in Tallahassee with the Big Bend COC and Ability First. How did this all start? Why don't we start with Jackie and John?
So I've only been with Ability First for about 2 years. Jonna has been with the COC for as long as I've known her. So maybe Jonna will have some more insight on how Ability First and the COC, how that partnership started. But I originally, ever since I got my degree, I've worked in homelessness. So initially started working with the COC on making sure that my clients were on that permanent supportive housing list and working to get them housed. And that's initially how I met Jonna, but maybe Jonna can speak more to how the relationship originally formed.
Sure. So long before me, I came on in 2016, and long before me, Ability First was working with Big Bend Homeless Coalition, who was then the collaborative applicant, and worked to form our first PSH program. They first took over a PSH program that was an individual program where there was a need, where Ability First was seeing a need for their clients who were experiencing homelessness to have a longer term subsidy, and therefore applied for PSH. They then brought on a family program specifically for PSH, so they do house 13 families through PSH. And then since Jackie and I have been on, we have worked to develop with them a rapid rehousing program as well as street outreach. So that is kind of how we connected.
Exciting. Okay, for Josh and Angie, what about you up in Virginia?
Yes, thanks for asking. This is, for me, it's a story that always excites me. I always like talking about it. Our partnership really began about 10 years ago in our region. It went from really no activity with any programs serving those experiencing homelessness. There was a real void. So we had a local, in our big 10 county service area, one of our counties had a resource council that was meeting monthly, and we had a little subcommittee, and I was a member at the time, subcommittee for affordable housing and homelessness. And it was just really a discussion thing. And from that, we had some key folks at different domestic violence shelter, the Department of Social Services, the Community Services Board, a couple of smaller community-based organizations. And we began talking. Then we received a grant from the National Coalition to End Homelessness, a community change grant that allowed us to hire a consultant. And we developed bylaws. We became, we then went to the 10 county, to cover the 10 county region, and we gained approval from the Department of Housing and Community Development to be seen, or at least Bay Aging, to act as the lead agency. It was an interesting kind of concept at the time, because folks were everyone was reluctant to just jump in and, oh yeah, we want to be the lead agency. Nobody had necessarily a burning desire to do that. It was a new thing. It was a new direction. Bay Aging, however, was serving the 10 county area already through all those other programs I spoke about, transportation, health, and housing. So a lot of the folks in the room were looking to us to, that maybe tacitly approving us taking that leadership role. And so we do take that very seriously, that leadership role, and we did acknowledge the need that existed, and that it would complement the existing programs we had, all that housing that I was talking about, the housing that we were developing in the rental housing communities. And folks were already moving into those properties that had previously been homeless, but we weren't necessarily making it a formal thing. So all that happened, and now Bay Aging is the lead agency, and we manage the point in time, coordinated entry, HMIS. So very proud of that history. I hope that helps. And Angie, if you have anything else.
I think you covered it, Josh. Thank you.
Let me ask one more question here. What qualities do you look for, each of you? And I want to hear from each of you. What do you look for in your potential partners? What do you need in order to successfully collaborate and or create the change that you're each working towards making? I will say I also saw a lot of comments in the chat where people said, I'm from the homeless system. I'm trying to reach out to aging. I can't get a response. I'm in the aging. I'm in the disability system, I'm in the SIL, and I'm trying to reach out to the homeless system, and I can't get a response. I will say, from the homeless world, please don't, please, they are in the middle of, Joanna, I'm shocked but thrilled that you're with us because they have a competition that's due for all of their funding that's due at the end of September. They have another, what's called NOFO, Notice of Funding Opportunity, that's due for unsheltered and rural, that's due in mid-October. So on the homeless side, I would say, please keep trying and please call people a couple of days after October 18th. You might get a slightly different response. But I just want to hear from you all. What do you need from those partners?
I have actually been answering my email. I'm getting tons of questions from applicants right now as one of our, we have some things to do tomorrow. But I will say that what we look for in a partner is someone who is actually serving our population. We will look for kind of like a mission that aligns with our mission, making sure that the agencies that we partner with have the ability to provide low barrier and housing first focused programs. So those are mostly the things that we are doing. We are at this time definitely looking into capacity building, as we have noticed that a lot of our agencies are kind of over it. They have reached a point where they have just come to the end of their capacity, and we are looking to build some capacity within our community. So I think at this point it's a pivotal time to start building those new relationships with agencies and organizations that you haven't already been working with.
Jackie, what about you from your end? What do you need from a partner?
For us, just learning from our partners, what services they have to offer, identifying kind of like gaps in our services and how they can help us, and just learning about all the specialties so that we can give that information to our staff and they can be aware of all the resources. So when they get a client, they know here, here, and here, they know exactly where to send that client for everything that they need. So definitely keep communicating with those partners because things are always changing. Just making sure that we have the resources to give to our staff, to give to the consumers.
So Josh and Angie, we've got 2 minutes before I've got to hand it back to Lori to close us out. So what do you look for in partners?
Angie, do you want to say anything on this? What do you think?
I think the other ladies did a great job of covering the types of things that we look for in partners. And I just wanted to add something that might be of interest to folks, something that we do to keep our partners engaged. We do a weekly newsletter, and we also do a once-a-month landlord newsletter. And that can be anything from, hot topics or fair housing information, and just keeps us engaged and in touch with them on a regular basis. And that's been helpful for us in maintaining those relationships over the long term.
Right, it's maintaining the relationships over the long term. So true. And with that, Lori, I will hand it back to you.
Well, thank you, Marcella, and thanks to our panelists and our speakers today. This has been great information. We are taking all of the questions that you all are asking through the chat, and especially those in the Q&A function, or if you've sent them to us in our email, and we will respond back with a frequently asked questions document to respond to these questions. We're sorry that we are getting a little short on time, but it's clear there is so much interest in this topic that we need to develop a few more webinars and opportunities for technical assistance. So watch your emails and newsletters and things for that. If we move on to the next slide, We want to announce some information about a free training that our colleagues at the Centers for Disease Control and Prevention, CDC, have made available. And this is available for anyone who serves people who are experiencing homelessness. And you can access this training. There is a link on the slide, and you can also access it by creating a free account at www.train.org. And the course provides trainees with the knowledge and skills needed to ensure public health protections reach people experiencing homelessness and recognize and respond to public health emergencies among people experiencing homelessness. Upon completion of the course, those who take the course will be able to take action to form partnerships with homeless service organizations, ensure that people experiencing homelessness are represented in public health data and analysis, and tailor public health interventions and measures for people experiencing homelessness. We want to especially, again, thank our colleagues at CDC for developing this training, and it's an excellent training. I encourage everyone to take it. If we move on to the next slide. We'd also like to highlight 2 case studies that we just released today. These case studies feature Bay Aging in Virginia and AgeSpan in Massachusetts and their partners, and include approaches to promote greater housing stability and strategies to address homelessness. We encourage you to visit our website and look at the What's New section to view these case studies. If you register for today's webinar, we'll send you the links to this information. After the webinar, we also have some additional resources that are shown on the slide here. They are the HUD landing page for the Continuums of Care, or CoCs. There's a link to the HUD point in time counts, and a link to the HUD housing inventory chart, or HIC, which is a homeless related housing program and units in your community. And then the HUD Continuum of Care board, so you can see where your continuum of care might be in your community. If we move on to the next slide. These links will also be put in the chat. We'll also make them available in the materials that you'll receive from this webinar. We'd like to ask you to take just a few minutes to respond to our 5 questions and rate different aspects of today's webinar. Your feedback is so important to us. I know we have a lot of information to cover. We're trying to get as much to everyone as possible and also help to facilitate partnerships. So please let us know how we can do this better. We do read all the comments that we receive, so please take time to fill out the survey form. And on the next slide, we want to hear from you. The Housing and Services Resource Center, or HSRC, is all of our Housing and Services Resource Center. And email us at hsrc@acl.hhs.gov about what your technical assistance needs might be, website suggestions, and tell us about your own cross-sector partnerships. We use this information to help develop our faculty for future technical assistance materials. Next slide. Finally, we want to thank today's speakers, our HSRC colleagues at HUD. Thank you so much, Sharon, for your presentation today and your preparation. The ACL housing team, especially our colleague Ramteen Makari, who at the last second put together the YouTube live stream. Thank you so much, Ramteen, and Alicia Anderson for her work. And we want to especially thank Mission Analytics and US Aging, who are our contractors for the Housing and Services Resource Center. Melissa, our ASL interpreter, she's done an amazing job today keeping up with everything. Thank you, Melissa. And Nick, our CART specialist, for their roles in producing today's webinar. And we're especially grateful for everyone that's joined us today. Thank you for sharing all of your information in the chat. It really does help us to continue to work together as a collective team to help people get stably housed. Thank you and have a wonderful afternoon.